Awesome, thank you. So this webinar is to present the system change request 8643 that's going to be released with the CWS CMS update this Saturday, February 25th. And so this SCR webinar is going to primarily focus on the functionality of the system change. There will be an ACL that's going to be released as soon as possible to provide further policy guidance. So yeah, just getting us started. And next slide.
Hi all, my name is Johnny Questis. I'm an analyst with the Integrated Services Unit. And just a little housekeeping, please everyone make sure that you're on mute since we have a short presentation. We're going to try to get through the material first. And at the end of the presentation, we'll have a Q&A section where you can ask questions there. You can also place your questions in the chat and our team here will try to get to those questions as soon as we can. Also, this webinar is being recorded and will be shared and posted at a location that will be shared. Also, these slides that you're going to be reviewing today will be also shared in the future as well. Just want to give my appreciation for our presenters today. We have representatives presenting today from CDSS, from the policy, research, and CWS support teams, also with OSI, and these are your folks who are experts in working with CWS CMS. So want to give my appreciation for them. Also want to give an overview for today's session. We're initially going to be presenting reasons for the updates. Then we're going to talk about the applications of the data. And then we're going to go into more detailed information about the location of the update, the functionality of the update, then the reminders that come with the update. And we're going to be ending with a Q&A session at the end. And I'll hand this to Heather.
Hello, so I'm going to go over the reasons for the update. So as part of the Child Abuse Prevention and Treatment Act, or CAPTA, states must report specific data to the feds through the National Child Abuse and Neglect Data System, or NCANS. If you're not familiar with NCANS, it is one of our federal child welfare reports that focuses on child welfare referrals that are investigated. And so this system change request is streamlining existing data collection for NCANS so that we can more accurately capture the number of clients in investigated referrals who are affected by drug use, alcohol use, mental health needs, and domestic violence. And in addition to streamlining NCANS reporting, this SCR is also responsive to county and stakeholder requests for additional needs-related data. So we have better information on drug and alcohol use and needs, mental health needs, and domestic violence. Next slide.
Thank you, Heather. So just wanted to give an overview of the applications of the SCR material. So initially, you're going to be getting more information regarding your clients related to drugs, mental health, and domestic violence information. This is going to be helpful information for safety concerns if either the investigator or provider is going out into the field. You'll have this information available for you. Also, this is going to give more county insight into allegations of general neglect, so you have more details related to these allegations and a place to document them. And finally, we're going to have a place to extract information related to variables that are affecting your community. So if you're from a county or from a tribe, you can get this information and use it to inform specific, for example, grants or efforts to engage in the community to address any substance use or mental health or domestic violence related issues in the community.
All right, that brings us to the location of the update. So when you open up a referral in CWS CMS, you're going to go to the client notebook. And from there, you're going to go to the ID page. And so you'll see that the current drug/mental health needs affecting this client has an updated grid in the bottom right corner of the client ID page. And so this grid provides the ability to identify drug use, alcohol use, diagnosed mental health needs, and domestic violence exposure for each client in an investigated referral. So of note, there are two different grids that document substance use and mental health information in CWS CMS. One grid is accessed through the referral, and one grid is accessed through the case. This SCR 8643 is only impacting the grid accessed through the referral. So information entered into the grid here does not transfer into the grid access through the case. And the functionality has not changed for the existing drug/mental health issues affecting this client grid access through the case, which is still available for all clients in the case. So there will be further instructions regarding the grid access through the referral with the forthcoming ACL that's been mentioned. And so for instructions regarding the grid access through the case, please refer to ACL 21-135. Next slide.
So here we are summarizing the changes made to the grid in the referral, and we're talking about changes to the grid because if you are familiar with the referral section in CWS CMS, this grid will look familiar. It is currently available just for the perpetrator in the referral, and what we're doing is we're taking that grid and we're making it available for all clients in a referral. So first of all, we're changing the title of this grid. It used to be Drug Mental Health Issues Affecting This Client, and we've renamed it to Current Drug or Mental Health Needs Affecting This Client. And we use this language so that it's more in line with NCAN's reporting requirements. As I said, it was previously available just for the perpetrator in a referral, but we are now making it so that it must be completed for every client in an investigated referral. And we'll talk more about what we mean by must be completed in a later slide. But when we say it must be completed for every client, we're talking about every child, youth, non-minor dependent, parent, caregiver, anybody who's made a referral client and attached to this referral, this grid will need to be completed for, with the exception of referrals that are not investigated. So you only need to fill this out for clients if it's an investigated referral. So this would not apply to referrals where you have determined that the response type is evaluate out or NA secondary report. In addition, we have renamed the mental health issues frame, and it is now called diagnosed mental health needs, again, to be more in line with NCAN's reporting requirements. And we've added a domestic violence frame. And if you indicate that the client is affected by domestic violence, then there is a client role drop-down menu, and you must select the role of the client in domestic violence, whether they're the perpetrator or the victim, or it's unable to determine what their role is in the domestic violence. And for each of these frames, for drug, alcohol, mental health, and domestic violence, we've added an unable to determine radio button. Next slide, please. So in this slide, I'm going to go over how you would fill out this grid. And what we're showing here is how you would fill it out to say that, yes, these needs are present. I will also briefly go over how you would say, no, these needs are not present, or how you would say unable to determine. The definitions that we're showing here are based on NCAN's definitions of these needs. And so how we want to collect this information so that it is reportable to NCAN's. We are not showing here definitions for the domestic violence client roles, but those definitions for the different roles, those come from the SDM tool. And we have a note here at the bottom that These are pending release in our all-county letter. There will be much more detailed information in that all-county letter. So these are pending, but we don't expect these to change because, again, we're trying to be more in line with NCAN's reporting requirements here. So when it comes to drug use, when you're filling this out for a client, you would select yes if, for a parent or caregiver, if they are currently engaging in a compulsive use of drugs that is not of a temporary nature. And if you're filling this out for a child or youth, you could use the same definition, or you would also select yes if the child or youth was exposed to drugs during pregnancy. And for NCAN's reporting, it doesn't matter how old the child or youth is. If they are any age, they could be 17 years old. If they were exposed to drugs during pregnancy 17 years ago, you would still select yes, and that's how NCAN's wants that to be reported. Alcohol use is a very similar definition. For a parent or caregiver, you would select yes if they are currently engaging in a compulsive use of alcohol that is not of a temporary nature. For children and youth, it's the same definition, or you would select yes if they have fetal alcohol syndrome or were exposed to alcohol during pregnancy. Again, no matter the age of the child or youth, if they were exposed during pregnancy or have FAS, you would select yes. For diagnosed mental health needs, you would select yes if the client currently has a clinically diagnosed condition. There's an asterisk here because there will be much more to the definition in the all-county letter that comes. There's more to the definition from NCAN's, but what's most important here is that you would only select yes if they currently have a clinically diagnosed condition. And then for domestic violence, you would select yes if the parent or caregiver is currently involved in any abusive, violent, coercive, forceful, or threatening act or word inflicted by one member of a family or household on another. And you would select yes if they are the perpetrator or the victim. For children and youth, domestic violence is not reported to NCAN's. It's only reported as a parent or caregiver risk factor, but we would still like to collect information here for the children and youth. So if a child or youth is witnessing domestic violence, we would like an indication of yes for them and a client role of victim. And just one other note I want to make about all these definitions is you'll see that current is in every definition. And what we're really trying to do here is capture needs that are present at the time of the referral. And so what we don't want to capture here are past diagnoses that the client no longer has. We don't want to capture past alcohol or drug use if they're not currently an issue or a need. So really focusing on things that are present during the referral, at the time of the referral. So that's how you would fill it out to say, yes, the client has a need. If you had enough information to determine that the client does not have a need, then you would select no. And if you didn't have enough information to determine that yes, they have the need or no, they don't have the need, that's when you would say it's unable to determine whether they have the need or not. Next slide, please.
So if this grid is not completed for all clients, then a reminder will show up in the reminder notebook, and the user will not be able to close the referral. And so this reminder message is only going to show up for referrals that were investigated. The reminder message will read current drug/mental health needs incomplete. And so this release applies to referrals created on or after the release date of 2/25/23, meaning that when closing a referral that was created after the SCR release, there will be a reminder that shows up, but it's not going to prevent closure of the referral. So that's an important thing to note. Next slide.
Yeah, for this section, we're gonna ask our partners, Gina, to support this section.
Okay, the release notes for release 9.1 are on two locations. One is on the CWDS training portal, which has all the training materials. And the other website is the CWDS website, which has release-related documents and, of course, other CWDS folders that counties may need to access. If you go to the first one is the training portal. if you go to click on that link, that's the link that will get you to the training portal, and you, oh, am I supposed to be sharing? Am I supposed to be clicking on here and actually doing it?
Oh, no, you're fine.
Oh, okay, because I see something that says I'm not seeing anything in the chat. So, well, that's not for me. Okay. Okay, so if you want to get access to the release notes through the training portal, you would click on the link that you see on the slide, and the welcome to the training portal screen page will open, and you will have to log in. If this takes you directly to the training portal, but it still will ask you to log in if you're currently not logged in. And there is a log on button in the upper right corner of that page, and you click on it, and then you would put in your user ID and password if you have one. If you don't, you would have to register, and you would fill in the information once you click on the register button, and then fill in the information, and then you will be sent a link to your email, and you would click on that, and then you would come, it brings you back, and then you would enter that the information that you get in the email. And once you're completely registered, you shouldn't have to register again, but you will have to log on every time you want to access the training portal. So once you have completely done, successfully logged in, there is a button in the navigation section for release changes. And once you click on the release changes, you should see the release notes and any other documentation that is available for release 9.1. And it also has some previous releases if you are needed to access those materials as well. And in the release notes, the table of contents, you will see the all the different releases. All the different SCRs. And there is a section for SCR 8643. It will list all the changes that has been talked about previously, and others we may not have talked about yet. So that's where you'll get all your information in the release notes regarding SCR 8643. So the second way to access the release notes is through the CWDS website. Again, you see the link there to access. And again, you will, if you don't have a login, or if you're not logged in, you'll have to log in. And once you log in successfully, it'll take you right to that page, and you'll see all the documents related to 9.1, of which the release notes are part of that. So did I leave anything out? Is that
Not to
okay?
my knowledge.
Okay,
Thank you so much.
you're welcome.
All right, that brings us to our Q&A section. There is 10 minutes allotted for this. I'm wondering if anyone has any initial questions or any comments or thoughts. I'm looking at the chat. I'm not seeing anyone right now, but I think there is an opportunity to put it in the chat, or if you want to unmute yourself, I think that's something that we can also go ahead and do.
I don't have any questions, so I'm going to mute myself back.
All right, thank you. So I do see a question in the chat. It's, do we have a number pending for the ACL? And we are still waiting on that, but that's going to be shared as soon as possible.
Do we have a name? Are we pretty sure the name is going to stay the same? Sorry, I don't have it open at the moment.
Yeah, I don't anticipate it changing at the moment.
Could we provide that so at least we know what to look out for?
Yeah, I could place that in the chat.
Thank you.
Okay. So I see a question from Philip asking about, or is it possible to unmute Philip, Johnny? Also read it too.
Philip, can I get Philip's last name?
Starts with the C. I don't want to butcher it. Cuaresma.
Yes.
So
Philip
my
is now
question-
unmuted.
My question was, I'm wondering why, or if there's a particular reason that the information is not populating over from the referral when it promotes to a case. Because that seems like it'd be really useful information to continue to have.
I can take part of this if y'all want. So the two different grids are meant for two different purposes. I believe the county, or I'm sorry, I believe the grid in the case that came through an SCR that was created by a county for a certain need. This grid in the referral is trying to capture data specifically for NCANs, and it's time limited, right? We only want to know about information that's at the time of the referral. There are no start and end dates in the grid in the case, and so we don't want information to populate from the referral to the case and then, run the risk of it not getting updated. In the event that a need has been resolved, or services have been provided, or whatever the case, we want to make sure the data or the information is staying as up to date as possible. And also, again, because we didn't put that system change forward, we didn't want to do anything to interfere with that functionality. I don't know if anybody else on the team wants to add anything.
Yeah, I'm not sure. This is Johnny Questis. I'm not sure if this was already mentioned, but there's different guidance for completing these different grids. So for the referral, it's more NCANS driven to gather that information, and also in the case, it's more of a CANS guidance to completing that grid. So it's like Heather was saying, it's different information in the different grids.
Okay, thank you. That makes sense.
Hi, this is Taryn. I'll quickly add just a little bit. Just there were some confidentiality concerns around the sensitivity of this information as well. So by separating them, we help to kind of alleviate some of that. Okay, that's it.
Just to add to that, we will have more guidance on using the case grid versus the referral grid in the ACL that's forthcoming. So apologies if that's not quite there yet, but we will be providing more information soon. So looking at Q&A, I'm not seeing any other questions. Wondering if there's any other questions that are coming up for folks. We can support you with unmuting, or you can drop it in the Q&A chat too. All right. So if there are no more questions at this period of time, we do have another slide that we can go over with some emails that y'all can contact. I'll hand that over to Johnny to present.
Yeah, thank you, Anna. So if you do have additional questions, we have the following inboxes here for you to reach out to. If you have data-related questions, you can reach out to the Child Welfare System branch, and their email is user resource unit at osi.ca.gov. For policy and program implementation questions, you can reach out to the Integrated Services Unit at cws@dss.ca.gov. And for technical assistance related to emergency response program policy, you can reach out to the Family Intake and Engagement Unit at CFS Child Protection at dss.ca.gov. And just a reminder that this presentation is being recorded and the PowerPoint will be shared afterwards. I want to thank all the attendees and participants.
Johnny, before we
Yep.
close, it looks like we do have another question. I don't know if you can see the participants, but there's a little question mark box next to a couple folks. So can you unmute them?
Sure. You know what? I can't actually see their oh, okay. The little actually no, can you tell me which ones need to be unmuted?
You know, you could probably go up to participant and do unmute all, and then we wouldn't have to maybe, I don't know if that would work. Then we don't have to individually unmute people. We can try that. Okay, that looks like it worked. So if you're not going to ask a question, please put yourself on mute. But if you had a question, feel free to ask it now.
Hi, this is Nayeli.
Oh, okay.
I did have a question regarding the reminder message. Will that show up when the call is being screened in, like from intake before it goes out and is assigned to a worker, or is that just going to show up at the very end for when we're closing the actual referral after it's been investigated?
I can take this, but Nora and Gina can jump in if I'm saying anything incorrect. It's my understanding that it will show up as soon as you create a referral client or attach a referral client to that referral. It will disappear if you decide that the response to the referral is going to be evaluate out or NA secondary report. But as soon as you create the referral client, that grid will show and the reminder will show up for that client.
Okay, and so then will it'll be required for them to complete that before it's passed along, like approved?
No, so it's not like a mandatory field in the sense that we're used to where you have to enter something to be able to save and close out. It will show as a reminder until the information has been completed for every client. So there'll be a reminder listed for each client, and the reminder will show the name of the client that the grid still needs to be completed for. And what's going to happen is the referral will just remain open, so it'll continue to be listed on your caseload, or or it won't show an end date until that grid has been completed for every referral client. But it won't prevent you from transferring the referral or doing any of your other work, just from completely closing the referral.
Okay, got it. Thank you so much.
Okay.
Any other last questions from the group before we end? I recognize that we're at 12:30 right now. Alrighty. If there are any additional questions, I did throw some of the emails in the chat that were mentioned on who to reach out to if there are any additional inquiries. And so I think that this marks the end of the webinar then, and there will be a forthcoming ACL, and the recording of this webinar will be shared in the future. All right. Thank you.
Thank you all.